I'm Dr. Kellaway. If you're new to this, I'm so happy to have you with us today. And if you're a, a return Club Med person, thanks for coming back. I always like to have some new things, some new advice for you. And I also, another goal is to really get all of your questions answered. So hopefully we can get those things accomplished. Other goals for today. I want you to be able to identify strong areas of your application. I want you to be able, if you're a re-applicant, so this is for first-time applicants and also for people who have applied before and not been successful. So I want you to identify the reasons you may not have been successful. I want you to be able to identify those areas that need improvement and prepare some kind of course of correction and help you have a really strong application the next time. So for some reason, I can't, there we go. So there we go. So you may be asking, if you're an applicant or a re-applicant, how am I going to become a strong applicant? Well, you've heard this a million times, be well-rounded. I hate to put a quantity on there, but successful applicants do have a large number of very relevant and very meaningful activities. So honestly, on that bullet right there, I don't know if you can see me pointing, but to that second bullet over there, large number of activities, maybe the most important thing is that they are meaningful and very relevant. There should usually be a variety of different things in the different areas of the personal bio, some longitudinal. Your whole application honestly should show that you're willing to make sacrifices to do things for others, to show a heart of service and excellence in everything that you do. On that right hand of this slide, numbers part 1, 2, and 3. I'm going to go over those in a second briefly. But also look at your application after we go through some things and make sure you're not an underseller. Make sure you're using every character that you're given to maximize what you're telling us about all of those activities and things in your personal statement. Don't be an underseller. The other component that is sometimes relevant is an interview setting. I'm trying to remember if I have a slide on that specifically. You have to remember, if you are kind of a shy person, if you're a little bit introverted, or if you're like me and you get nervous and then that affects your message, you want to make sure you're practicing so that interview doesn't get in the way. I think all kinds of personalities can be great physicians. So the problem with being a little bit shy or introverted is that you may not be able to sell that enthusiasm, so you want to make sure that you can do that. Numbers part 1 means sheerly the size of the applicant pool with the number of spots that we have so far in the Texas pool, even the national pool, may be working against you. So hopefully I can give you some ways to make your application outstanding. I often say, could y'all mute your mics, please? Check your mic. Thanks. Thank you. You'll have some mics out there to be muted. Thank you. What I was going to say was, people said we just did a swing week where we visited lots of undergrad campuses. Maybe I talked to some of you out there, and a very common question is, how do you all not see the PowerPoint? Can y'all see the slide? Okay, great, thanks. I had a message there that somebody couldn't see it. Okay, sorry. So anyway, a very common question that we got several times a day at all of those schools was, what can I do? What can I do to make my, what should I be doing? What do y'all look for? Well, you know what? We're looking at your story, so you should be having experiences, seeking experiences that you love, that you can be passionate about, and then find a great way to describe the activity and what's meaningful and valuable for you. And then that tells your story in a powerful way. So that's how you stand out. You're not, it's not going to be that you're the 1 in 6,000, right? But if you tell your stories in a meaningful way, then that's gonna help. So numbers 2 means that you may be caught in this trap, but there's a big caveat. You all probably know that you're supposed to apply early. And when you look at this pie, I'm not sure if you can see my mouse or not, but look at May and June. If these represent people who submitted their application in May and in June, and those, oh, good. You can see my mouse, so you can see me pointing. I'll try to not make it obtrusive. But the people who submitted their application to TMDSAS in May and June comprise almost 75% of the interview pool. So, so for that reason, you want to make an early application. But a lot of people go to great lengths to make this happen, to be a May or June submission. But honestly, if it's not quite ready, I'd rather you even apply in July and August. Excuse me. People who are in school, finishing a busy semester, for example, trying to take finals and the MCAT at the same time or close to the same time, that's just maybe sometimes not the best plan for you. And I advise a lot of people, finish your semester strong, take your finals, and then see if your resources will allow you to take 4 to 6 weeks to 2 months off to study every day, every single day for the MCAT, and do that later. So submitting your application means getting all the TMDSAS things done, but waiting on something. Your letters don't have to be ready, then that those things can come along later. I'd rather see people study through May and June, take a strong MCAT into June and July, and come back with a strong MCAT to add to your application. And numbers 3, just so you know what the averages are, that can be another reason that you haven't been successful yet. The applicant pool, the applicant pool averages here at the top with maybe a 3.6 and a 5.05. The interview pool, this is from last year. So right now, I don't know about the interview pool for 2019. It's probably very similar. But for the nation and for Texas, our averages are around a 3.75 overall GPA, and the MCAT is a 5.11. Over here in the bottom right, you can see our stats for Long School of Medicine. But if you're a lot lower than the national and state averages, then there are ways to do repair here, okay? And I can see if those are some of your questions that we need to answer along the way. I'm watching my chat in case people have questions. So that's what I just said probably relates to applying in your year. If everybody sort of gets in a hurry, and if you still have a lot of healthcare experiences to do that are planned that seem to be relevant or meaningful, or you haven't had a chance, you've been concentrating on grades and things, so you haven't had really a chance to do any other, like reach out and do some other things, then you may want to postpone it and do a gap year or even two. Medical schools will all be here. It's always going to be, this level of competitiveness, and doing things in a gap year might just make you a very strong applicant. Luke 12:48 is something I'm not going to be able to quote you, but it is, to whom much is given, much is expected. That's the paraphrase of it. So if you do have connections and people in the healthcare arena, you should make sure you're using that as a launch pad and not depending, for example, on your dad or your mom or your aunt who's a physician, but using them or not using them to go reach out and do some other things. And of course, the key question, if you are a re-applicant, is what have you done to improve your application? Sometimes you are just caught in one of those numbers dilemmas, but you should show that you've done some reflection and identified some areas to improve. Let me read this question. I don't know if y'all can see the chat. Can you see everybody's chat? I guess if it's to everyone, yes. So Tamara, yes, thanks. What if you're a non-traditional student with lots of hours and can't tip the scale much? Upward trend on the GPA definitely helps, okay? If you have, I would say, in a 3.4, 3.5 and up area, that's not too bad. I don't think schools, or very many schools, if any, have a formula, but one way to help that and show readiness is to have a very, very, very strong MCAT. So in that way, the MCAT is a little easier to tackle. It's one thing, it's one sitting, it's one thing where you can move a needle. But you have to really apply some time and effort into that. So the other thing I want to say, you're welcome, Tamara. Multiple MCAT views are, I think that we look at it here at Long as determination, and motivation to keep trying and to do better. So it's generally seen as a positive thing. I wanted to say also, just because it doesn't apply to too many people, but if your GPA is affected by a couple of semesters, say you've got a couple of semesters that are almost 10 years ago, then you should look at Fresh Start, because anything 10 years ago and previous can be wiped out. And then you can, your bachelor's degree still counts. I'm sorry, does it still count? That might wipe out credits. I think what happens is I'm not the expert here, but there are lots of resources out there, and it has helped a few people that I've talked to every year. So you go back and get a second bachelor's. So when you're really motivated, maybe that Fresh Start can help you as well. So let's see what else I've got here. I'm moving things so I can see my slide. Another slide on general tips. Did we see? Yes, I think we saw the others. Is to really make sure you're describing your activities. If you look at every single one of those activities that you're going to describe and say, how can I convey how meaningful this was to me? Then you might be able to describe your activities a little better. Some of you have heard me say good, better, best. It's good to list the activity for sure. It's better to list the activity and really have some details in there about what you did. But the best thing to do is to make sure you list the activity, tell a few details, but tell what is very meaningful, what was valuable, and what did you learn from that specific activity. So that's the best way to use those brief 300 characters that are in that section for the personal biography. I I don't think too many people oversell. Sometimes we see lots of repetition, so you need to repeat only in the right places. If it is a very large activity, like a big research endeavor that you have done for a sustained period and there's some clinical or healthcare experience in there, you can break those out, but you wouldn't copy and paste the same description. You see what I mean? So if it's a big thing with leadership and service, you should break those out. You are very welcome. So, I'm not sure how AP credit from high school would be affected. Um, I guess it would depend on how that is listed on the college transcript. So make sure y'all are muting your mics, please. Thanks for joining us. Yeah, if you have, yes, non-traditional, if you're non-traditional and you work full-time and you are asking about the variety of activities and volunteer experience, that's still going to be, the committees recognize this, but you're still held, to the same ruler. We're trying to assess people in similar ways so that the process is fair. That being said, we do understand people who have work, but we do see people who leave a lucrative position, for example, in a firm or financial arena, business, something non-healthcare, to get something in healthcare and be closer to the life that you want to be leading in healthcare. So unless you can fit in some of those other activities and volunteer experiences, changing your job would be something that you might want to consider. Repetition in the right places. I've talked a lot about shoebox method. We can give you a recording on that. We're going to go to the personal biography in a little bit. But mostly I would ask you to do a very real, a critical self-assessment. And you can't see all the applications that I can see, of course, but you're listening to what I tell you, you're seeing the averages and that kind of thing, which should give you a launch pad for, or some sort of touch base. What am I trying to say? Some sort of not exactly always metric, but a starting point to start that self-assessment and really look at what your application brings. Let me look at the chat. Some of your questions may be, should I put this in? Should I put that in? I'm doing this or that, and one of my mantras is all good things are good. All things, large and small, all good things are good. Everything counts. So it's just that we'll talk about some high value things. Let's see. Somebody's a full-time mom. Oh, wait. Yes, that's good. Thank you for sharing, Tamara. And there are some Saturday things, some mentoring and some community service things where you can join other people or even take, your kids maybe. Yes. When you talk about checking the box there in the chat, we really can sort of tell what is checking the box, and usually it relates to a very limited experience in that category. So this is admissions components overall. We do use a holistic review. We look at metrics, experience, and attributes. We have another couple of things here with the interview. We're requiring the Casper, of course, now. Happy to answer questions about that. um, what was I going to say? The three-legged stool here, because there's a little bit of a myth around holistic review. The myth is that if you're very strong on experiences and very strong with personal attributes, highly motivated, very altruistic, lots of great healthcare and community service and leadership activities in particular, that you can have success with low metrics. And what that's not really what we're looking for, and what a lot of people using a holistic review process are looking for. We're looking for balance in all those areas. So you really do have to have academic strength in all areas. Thanks for joining, everybody. Make sure you mute your mic. Military service is viewed very positively, and it's sort of leadership and community service, and sometimes healthcare as well, depending on your situation there. Can't tell, is my chat box in your way? Is it covering up the slide? Is it just covering up my? Okay, great. So I'll just move it out of mine. I think entrepreneurship are those activities or ideas or things that you have put into action would be very positive. Casper is, we use it in a way that is called, it does influence our committee discussion. It has some influence. I think there might be other things in each individual application that take on more weight than a Casper, but we use it what's called impressionistically. We might see somebody with, a good application, but we see a very, very strong Casper. Actually, at several points in the screening process, we will go through who we have screened in to invite for an interview. And if there's a very strong Casper score, we go back and search for people with very strong Caspers, knowing that that's a standardized setting that is testing, showing us something about those 10 personal attributes that they're testing for: teamwork and collaboration and altruism and all those things. What else was I going to say? I believe there's some new things about Casper besides the fee has gone up a little bit. They are going to, I think, start sharing with people where you land. They're going to report to the student or to the taker. They're going to report your metric in quartiles. So they'll let you know if you're first through fourth quartile. So that's interesting. All of these things are components of the application that we look at. I want to caution you about photos. Really, every year, this past year, I'm thinking of a few, there were some splits in the committee. Some people said, we really should not interview this person because the photo was sloppy. A wrinkled t-shirt at the last minute just really doesn't make a nice impression. And you might have a wonderful, great essays and personal biography, and your photo is sloppy. And that really puts a damper on the discussion. And I don't think we're much different than other committees. Make sure your email isn't something goofy. Be honest if you do have violations. We take that very seriously. Honestly, it is not the violation that bothers us quite often. It's are you being true to yourself? Have you learned something from it? So how you address that in the application is going to be important. And we'll get to the personal biography here in just a second. There's a word about photos. You can pick out some very nice professional photos. It'd be nice to see a collared shirt, I think, dressed professionally. I think Hand gestures we're not that fond of. Social pictures in social settings or with your family are not that important to us. It is not really for identification. This, climbing some mountain, I'm sure would be a wonderful accomplishment, but when I look at a picture, I'm looking at when I come to the ER and see this person as my doctor, am I going to be pleased? Do I see a warm, caring smile in this person? And I think that's what the picture should convey. But that's enough about pictures and goofy emails, because you all know those. You've got 3 essays. They're both updated a little bit. These are sort of paraphrased now, but you should use them. A word about the essays would be, make sure you are telling your story. Do not make it an essay about medicine. Talk about your experiences with patients, with people you have served, with people you have served in special settings like the underserved or in another country. Talk about your experiences with a physician and what they have shown you about this, about this life in medicine. Research, let me see where I am on the I'm looking at the chat now. Let's change so y'all can look at the other things. We're going to start to talk about the personal biography in a minute. Good attributes and experiences boost the application. Absolutely, and we'll get into that. I'm going to talk to you about what is high value in this personal biography section. And research is not a deal breaker for us. I'm reading that the mic cut out. I'm hoping y'all can hear me. Is there a way to know if it's, so the Casper, if you've got a negative, there are going to be schools where a high minus, it's reported as a Z score. So there's a broad range, and we can see about a +3. That's pretty rare, but some +2s to -2s. If you're on the negative end for us, it really isn't even considered if everything else in your application is positive. So it doesn't really affect people negatively for us. It will for other schools who do use it to some extent for screening. And yeah, I'm not sure now that they're going to report it. I guess if you're in the 4th quartile, you would want to think about how you're explaining answers to situational judgment tests. There are ways out there to look for situational judgment tests, and just get in a group and maybe share it. Maybe we'll do something on that. That's a good idea. I'm going to write it down, but maybe you'll email me to remind me. So I'm hearing problems about the, yeah, thank you, Deli. The TMDSAS Apply magazine, which you can download, is a fantastic resource. I'm hoping you can hear the mic. So in this personal biography section, you want to make sure that you're, please make sure you read the TMDSAS handbook. And I already told you what good, better, best means, and you have an opportunity now in the most recent applications to mark the most meaningful activities to you. Yes, I'm gonna specify what's considered healthcare or community activity. The other thing that we have had a lot of questions about recently is, clinicals. Experiences, healthcare versus clinicals. I don't know if any of you have that question. Our committee And when I brought this up at the dean's meeting for other schools, we don't really separate that out. If it's a healthcare experience, the high value is direct patient experience, direct patient contact. That doesn't mean that you're necessarily taking the vital signs. So it could be just as valuable as a scribe. Okay, so in terms of that, so let's get on honors and awards, anything that's competitive, including scholarships and grants. If your research was selected to show at poster day or to present in a research class, if you're doing a research course, be sure to point out that's where good, better, best comes in. The best way to list something if it's a course. Sometimes those things are minimized by the committee. You want to maximize that by telling what you learned in that research activity. Remember, there's a non-academic section here. So if you do sports or arts, submit your poetry, to a poetry contest and tell us about those things too. Leadership is very important. A lot of people stop at club officers, but there's only a limited number, honestly, who come in with leadership positions in organizations. So think about other things that you can do that are leadership. One thing that's not on here. So I direct you to the bottom there where it says take initiative. Get a group together to go do something good. I've thrown this out a couple of times. I'm excited to see who will take me up on this. Big Brothers Big Sisters, for example, would be very high value. That requirement is a minimal requirement, 1 hour a month, doing very high value, heart to heart, hand to hand mentoring for a young person in a situation of risk. So to take that on would be under this teaching, mentoring, coaching, and maybe even some tutoring activity here under leadership. What if you got friends together and you all took part in this, and once a month you got together with your littles and did a group activity? I think that takes that activity to a new level. So take some initiative to get some group together, maybe to do some things. Eagle Scout. So thank you for asking about Eagle Scout. That is a good question. The directions in the handbook, which you must read, say, tell us about your college experiences. So if there are some things that are pretty special that you have done in high school, if it's a motivation spark, you can always write about, if you went to a health careers high school, those are things you can write about in one of the 3 essays. And otherwise, people are going to forgive a big thing like Eagle Scout. That's a pretty important thing. So make sure you list that with leadership. And volunteer. So we don't have a category, if you'll notice, we don't have a category that says volunteer. It would be community service. So if there are community service things that are also leadership, this is why you do everything ahead of time, so you can kind of see where your experiences are landing with these categories, because that's how we're going to look at it when all of us admissions people look at it. So you can, if something is a volunteer activity, rather a paid activity, you would go ahead and repeat that under work experience. For example, if you're a scribe, you're getting paid for that, but that's a significant healthcare experience and a high value one. So you want to repeat that under work because it is paid. So no, healthcare activity is not only when you provide a service. It's a healthcare activity. We'll get there in just a second. So I think having pro bono clients would be good. It could go under both if you have leadership as well as serving those people without cost. High amount of hours in research can only be detrimental if you don't have balance in the application, so we're going to need to see healthcare and community service in particular, or some leadership. Yes, I think some might question that, but I think if you just have balance in the other areas, it's going to be okay. Especially point out some clinical areas of research. That would be good. Volunteering that is political in nature. So let's talk about that. I'm going to go ahead and change the slide so you can see what's next. There's research there. Volunteering that is political. I think I think those are some very interesting things, and they're not very common. So those would be unique things to add to your application. The downside would be, and we talk about this in the personal statement workshop in particular, if you're talking about politics, we have a few people every year who've worked on a campaign. We're coming up, with a national election. So I think admissions committees are careful. We are careful about our biases, okay? And you should be careful about your biases. To us here at Long School of Medicine, but also to many admissions committees, we want to train doctors. We want students who have a future in helping everyone and trying. So we believe in everybody putting our biases aside and being able to take care of people from all directions to help communicate in a way that is not judgmental, that is balanced, and especially respectful. Those are things, if you are doing something that is polar or can be polarizing, why don't you use that as an opportunity to say how much you respect people on the other side, right? Or at least let that come out, I hope you're understanding what I mean by that. That would be very, very important to us. It's a test for all of us. And honestly, on our campus, I think you've heard me, a lot of you say, or you've visited our campus and see it is a very, very collaborative, interactive student body. But we have people on both sides of many issues, and our students are able to hold high respect, hold each other in high respect, even though there might be very polarizing issues that they sit on opposite sides of. So that's a good question. Thank you for letting me veer off into that. Let's see. Organizing protests, I guess it would depend. Same sort of things. Does it matter how much time has elapsed? So we want to see some current things. We realize if you have been out for a while, leadership might be an area where we're not seeing things that are very current. That's why I mentioned the Big Brothers, Big Sisters, because that might be considered leadership if you get a group together to do something, or to start a food drive with whatever community you are involved in outside of your undergrad work, right? So we really, really need to see current healthcare and community service. I think if you're getting a lot of interviews, I want you to review your interpersonal skills and see if nerves got the best of you. I'm looking at the chat right now still, or some of those other issues we talked about. If you're a quiet person, make sure that your enthusiasm comes across. Make sure if you are a person, this is my younger son for sure, a person of few words, three word answers, that you can expand on things a little bit. Sometimes those are the things that pop up in my mind. I guess the opposite of that would be if you tend to not listen or over talk, interrupt people, or go on and on and on and on without letting a conversation happen. That those two extremes are things I think that happen most often. So I think working with the TMA and the AMA is excellent. Those are sort of unique things. So yes, Sharon, highlight those. I think shadowing one physician in a strong mentoring relationship there is a good thing. I would ask you again to maybe have a little bit, and I guess it depends, if it was ophthalmology, that's my field. And when I had people with me a lot, I would say, make sure you go see primary care or some other specialties. So one thing that would matter would be the context or the specialty. Yeah, it's quantity versus quality. Exactly. And that's why, thank you, Joshua. That is one reason we do not have a minimum. I don't suggest this, but I use this example all the time. I think that it's very possible through a whole entire application to see commitment, dedication, strong future in medicine with an 8-hour shadowing experience, because that is so meaningful and described very well. So I wouldn't suggest that you only do 8 hours, but I think you get my point. Experience, we love I think being in nursing is terrific, very high value, connecting with patients. Being a charge nurse, oh my goodness, some of the best things I ever learned about taking care of patients in the OR and on the floor and in clinics were from nurses, So I think those are excellent experiences. You do want to make sure you talk about interactions with the team, particularly a physician. Okay. Nurses do rock. Thank you, Joshua. Nurses do rock. And we have a couple of people in our student body who planned to do a nursing degree for that good clinical experience with people before medicine, and that was a purposeful decision, which our committee liked a lot. I think a lot of committees do. Would you expect more healthcare experience in community service? I'm not sure. There needs to be some community service. So it just depends on how much is there. So healthcare, if people are checking off boxes, we might see minimal hours in some of these categories, including research. If you're in an experience and you're gonna just say I just was washing test tubes, or if you're not getting much out of it, you just should find some other activity to do. Healthcare, why we don't list this first, actually I've asked on the maybe 2 years from now, but I think this should be listed first because it's the first thing we ought to see where you're going, where you're, what you've been doing. Where I talked about hours, shadowing and scribing. I don't like the word shadowing, because it sounds so passive. I like to describe it as an apprenticing situation. You are learning from a master, hopefully. Sometimes that's another presentation. But there's potentially great value in that. But I think for the last several years, scribing is also very high value. So those two things, shadowing and or scribing, have got to be in your, experience with a physician in a room who's taking care of patients and their families, you have to have that experience. Shadowing can be passive. You have been with great physicians or people who are trying to, letting you into that team experience, but didn't have much time to spend with you otherwise. And there are great people who do have time and can make time to go over the scenarios with you or go over the clinical findings or what you're looking for, some of the lab tests, and those can be extremely valuable. You're not always going to find that. So maybe sometime we can talk about that soon, because there are some things that you can do to set goals and make that a valuable experience. Scribing is very valuable. Sometimes people use that to launch into a leadership position because you're doing a good job at it. They make you a scribe trainer or put you in a setting that's a little bit more difficult, and you should describe those things to us as well. EMT training, CPR training, those can be good. Like I said, all good things are good. Do not put babysitting. It really should not rise to the level of an application unless you are truly a caregiver. That would be high value. We'll show that on community service, unless you're specifically doing caregiving for a person who needs some health care things done. I don't know, maybe checking vitals or insulin and things like that. Pharmacy tech for 5 years is excellent. Again, you have to have shadowing and scribing. So all these other things are going to be good. Let me read. I think if lifeguarding was, both my sons did lifeguarding. I regard that. I know the training that went into that. I know the teamwork that goes into that, and sometimes you're competing and all that. I think that is excellent. I think for people who might not know what that entails, you might describe it. And remember that extra optional essay, that doesn't have to be about one topic. We frequently see people hit, they do a paragraph on 2 or 3 things, and that would be one way. If you had, I think as long as you have lots of other things in this personal biography, people will forgive 1 or 2 high school things if it reads as a very valuable thing. College offers a committee letter. We're going to talk about letters of rec here. So I think I'm understanding, Farhan, that the letter's coming across, but it's too late to add in the packet. You get an extra letter for TMDSAS. And our school and several others, I think, take extra letters that we file those right in our application. So it doesn't hurt it because your committee letter, am I misunderstanding? So you've got some letter in there. You have to have some letters of recommendation in there. If it's not we don't really care if it's a committee or not a committee. We do realize that people go off on their own. And sometimes that's a good thing because you have people outside that committee who know you very well and can write about you well. Medical device sales. If you talk about what you needed to learn, again, my niece of my heart is in medical device sales. And I know what she had to do to sell her product and how she's in the OR all the time and how, honestly, sometimes the surgeon could step aside and she could finish implanting the lens and that kind of thing. So I know what that entails. You want to make sure that those things are in your application somewhere. So I might put it in healthcare, but I think I'd talk about it extra either in most meaningful section or in the 3 essays. No, so it's not unpaid shadowing for healthcare, listing healthcare. If you worked with physicians as as a nurse or a therapist or of some sort, I think that you certainly can add that. Make sure that you do kind of a reasonable, when we see people like with thousands and thousands and thousands of hours, there is some eye rolling or raising of eyebrows. So just, be judicious about describing that. So working as an EMT in place of scribing. So scribing, by definition, you are in the room with a physician. So I think that's the bottom line, is not working with patients, not just working with patients in your area of expertise, but being in a room with a physician who is taking care of patients. Because one of the big things we're looking for under healthcare is, do you know what you're getting into? So I think EMT experience can be very valuable. If you have other shadowing experience, you wouldn't need shadowing and scribing and the EMT. Hope that is good, Ria. But it sounds like that's good experience. If you are lacking in healthcare experience, if that's a real lack, again, EMT certification is not necessarily the high value thing. Okay. So it's a good thing, but I would get a job or a part-time job with scribing. Make sure you then come around with the next application having scribing or shadowing. But EMT is good. And you can just talk about the hours that you spent in the clinical versus classroom in the description. Yeah, and if you're paid, you can repeat it under there as a paid thing. So you can repeat that. Let's see. Home health, partially in the office, partly in the field. I think that goes under healthcare. You're in home health. So I would list that. I think that that's high value. I would imagine this is Udochukwu. I'm sorry. I hope that was close. Udochukwu. Someday you'll tell me how to pronounce it properly. I think that could be very high value and overlaps with what we do see in a heart of service. Usually we're seeing that heart of service mostly in community service, but home health, visiting people's homes, I might put it under healthcare. And then, gosh, it seems you might have some stories to tell about people that you helped. Technically, shadowing and scribing could overlap. I suppose they could. I mean, if you're there are some informal things when you have a longer term apprenticing experience with a doctor who's now asking you to do notes. Is that the overlap? Yes. But so you don't need both. They're both very high value. And I'm giving you my opinion. Remember, there are, how many schools in the state now? 13 in TMDSAS. Pardon me. And 13, 14, 15 in the state. So other people might have other ideas about that. And might require one or both. Thanks for helping with the chat. Prior military. Community service at the Red Cross. That's an excellent thing. No, I don't think it's too narrow. I think it's excellent. All good things are good. So yeah, volunteering and shadowing in the military. No, I don't think it's too narrow. I think it's excellent. Peace Corps is unique. It is 2 hours of devoting yourself to better the world. It will be high value. On your application, it seems to me we would see it first in the personal statement, where you might have lots to write about. You could then list it again, and please do, things in your personal statement or any of those essays needs to be in the biography as well. It might be in the main, it could go in any of the essays, honestly. And it might land also in your most meaningful list. Yeah. So I guess I'd on the personal biography section, unless you have leadership, I can see it in community service because it's a 2-year experience. I can see where you might have leadership there also. If you can separate out what you learned in those 2 areas or what was meaningful in those 2 areas of the Peace Corps experience, I think I think people are going to forgive you for listing it twice because there's a lot in that. Committee packet. Oh, yes, if you have trouble getting a committee packet uploaded on time. So honestly, we need to see it by the time of our committee review. And that being said, we do go to committee on a few people who don't quite have it there, and then we just chase it down. And I've even, contacted those committees or the committee chair or the health professional directly. We reach out to people also to let them know, that we really need it. That was a question about getting the packet uploaded. So again, about letters, I think that's perfectly okay not to use the committee. That's our opinion. We want to see some nice, strong letters. I'll just go ahead and say, if you're from a huge university, for example, sorry, UT Austin people, sometimes it's hard to find somebody who knows you well, and we realize that, and we do not put those students or applicants at a disadvantage. Hospice is great. That's interesting. Is it community service or healthcare? So it depends on what you're volunteering. Really, we see people who go and read to people. That would be community service. If you're volunteering in a more medical role, then you can list it as healthcare. Okay, you're welcome. You're welcome. So when I say biography, I am meaning this section of the application that we're on right now, the personal biography. So the personal statement could be any piece that you have already listed here in the personal biography. Your personal stuff, that being said, wasn't sure where you got that exactly, but that being said, your personal statement should sort of be your biography, it should tell the story of you. Shouldn't tell the story of medicine or, it should be your story. So community service is a very important thing, very important place. You have in this section a great opportunity to show us what you think about people, what you think about your fellow men and women and people. I call this the high value things are heart to heart and hand to hand. So that the most meaningful things that you do are things where you are actually spending time with a person. You are going to the nursing home to read the Bible to people on a regular basis. You go every Thursday to do bingo with the elderly at a facility. So helping, you would also put in this section 5Ks for breast cancer and blood drives and raising money, doing your MS 150 and all those kinds of things, fundraisers for a medical cause might all go in this section. Any sort of thing that helps people should go in this section. But we're particularly interested in using looking for high value things. The BBBS is Big Brothers Big Sisters. The other thing, I'll mention this here in this community service. You have an essay that's going to point out the unique things that you have in your it that are going to bring diversity to a student body. Thanks for joining, everybody. So if you could mute your mic, that would be great. Please mute your mics. And I'm sorry, it's my ADD. I get thrown off. Please mute your mics. Everybody check your mic. But this is a great application tip for you, because everybody does have wonderful and unique things to bring. Your background, the people you met, your culture, your family, your upbringing, there's just a million things that make you unique. We have seen a couple, I'll just give you the examples. We've seen a couple of people that impressed the committee quite a lot, and their activities, their experience were listed. Yes, HFH is Habitat for Humanity, sorry. They're listed usually in this community service area. And one was a young man. This was a man who was Muslim person who had a long-term experience at a nursing home facility, a residential living facility with the elderly. And this Muslim person was reading them the Bible. So what does that say? Our committee went, okay, wow, this is long-term. This person is serving people. This person must have an acceptance of all kinds of people. And the applicant also had some things with their mosque in this section, and that they wrote about in their personal statement. But we thought that was particularly good evidence of reaching out to learn about people or be accepting of all people. We thought that was particularly good. Another one was an applicant who was a young man who was white. I think his undergrad major or minor, there was some big part of his education in Latin American studies. So he loved Hispanic people and culture. What he did, and I forget where exactly he listed this, it may have been under extracurricular. What he did then to be with the people he was learning about was change churches, and every Sunday went to the Hispanic church or church in a Hispanic community to, commune with those with those people. So those were very good examples of reaching out. So getting out of your box. So this comes up in every committee meeting when we discuss lots and lots of people. Are you getting out of your box, getting out of your comfort zone, not just for you to expand, but to explore other people and cultures and that kind of thing. So let's see. So the advice for freshmen and sophomores is be a good student. The best thing you can do, and I think lots of people would chime in and agree, because GPA, whether we like it or not, those metrics are very important. So the best thing you can do as a freshman or a sophomore is, if you're making B's, learn how to make A's. If you're making A's already, take harder courses, be a more diligent student, get your time management under control, do extra. You know what I'm saying? So pursue things that are rigorous and demanding in your schedule while maintaining a strong GPA, and that is going to carry on from year to year and right into medical school. So that's what I would say for you now, and then stay tuned for personal statement. Stay tuned for shoebox, because freshmen and sophomores, the other thing you can do is get organized right away. Email me or Jasmine and we'll send you a couple of those handouts we have. Medical mission trips are very good. When it's all out of the country, then we look for a U.S. healthcare experience, but they're very good. And would it be considered medical mission? I see medical. I see. I'm sorry. You're saying should it be listed under healthcare or community service? We see it in both. You know, if you're really triaging people, helping with medical issues, then put it under medical. Community service in the LGBTQ community is absolutely positive. You know, we have a lot of experience there with our Pride Clinic, and our Pride student organization is very broadly based, and lots of people help in that mission. So yes, that's a very good thing. You're very welcome. Very welcome. So let's see, community service. Let's see what's next. So, you know, this is my favorite part, right? Those of you who are hanging in there. I know we're supposed to leave soon. As I understand, if you have to leave, of course. And I'm thinking about doing another web chat just for question and answers. We'll see if anybody's interested. I know I can block an hour in the future. So if you have to leave, I'm just going to keep talking here. But some of you know this is my favorite section. Yes, you're welcome, Josh and Cassie, because I know people do have to leave. I've always got so much to say. Yes, thanks, Sharon. I will. So this is a place where you can really show who you are. It's one of the first places, honestly, that I go to. And this really, you know, all the other stuff is, it's your life you're living and you're doing a great job. But, you know, we know that you're trying to impress us in all these things. I don't know. This seems like a very personal area to me. So what do you do when you're not studying for a test, you're not working, you're not doing something that fits in the other categories? What are you doing? Gosh, some people put nothing. And this is a place where you can really start to do some things, or improve some things, or just list some things that you might not otherwise think of. It's very common for people to put their student organizations. That's okay. But usually you've told us about them already under leadership, or some other, you know, in the statement. And honestly, that's not very exciting, but it's good. You should list them somewhere. But the things that are impressive are people who have started to teach themselves something. They're learning how to knit. They're learning how to speak Spanish. So you can do this yourself, right? So teaching yourself the guitar, teaching yourself tennis. What if you got a group together? I've sent this out a number of times. I'm waiting to see if it'll come back. What if you get together with a group who all need to learn Spanish? You know you know you're going to use it in the future. What if you grab a Spanish speaking friend who's fluent to say, hey, can we meet at the lunch hour or on Saturday afternoons at 3? You know, then what if you got a group together? There you go, leadership and this extracurricular activity that is expanded, you know, on steroids. You've given it a little oomph, something a little more powerful. Okay, I like roller skate. That's Erin, that's just what I'm talking about. Go learn how to do something. It's impressive. You're active, you are learning new things, maybe translating some skills to interactions with other people. If you're not a reader, be a reader. So that to Ria, and to answer that freshman sophomore thing, that's the other thing. Readers do well. We know that from multiple studies. Readers do well. They do well in standardized tests and things like that. So if you're not a reader, you could start a reading hobby, but list these things. Do not put, I know that the question, I have to go look and see, we had some new wording for it. It really doesn't mean like, what do you do when you're just sitting on the sofa? So if you put down there, you spend time with your family and friends, that's really almost of, yes, it does help with the car section for sure. Thank you. It's really almost, well, it's very, let me put it this way, it's very little, very, very little value. Non-trad ballerina is great. Tamara is recommending a book, How Doctors Think. I wanted to get that in the audio. That's good. Troy's question. Do I need to back up? Okay, I may have missed. Troy, hit me with it again. So happy to, oh, there it is. What about things you do with your own children? Okay, so yeah, that would depend. That would depend. So if you say on Saturdays, I take my kids out and we do stuff, so not as much. It's I think we're looking at some other things there. Okay. Oh, I just found another way. Sorry. Here we go. So uh, people who have listened to me before, I love this idea of a personal growth plan. So the idea came to me from some students and who actually translated these little things into their application. Let me give you the example, and then you'll understand. And these things then can become powerful and weighty enough to put into this extracurricular section in your personal biography. But one was actually two young ladies who wrote about having a difficult time being shy, very, very introverted. And they realized, one young lady was explaining in an essay, I believe, how she just really hated meeting new people. But she realized as a doctor, she was going to have to get comfortable doing that. Every 5 or 10 or 30 minutes, she was going to open the door, and who was going to be behind that door is a stranger and their stranger family with them. So what she did was she made a deal with her friends. She set goals. Every time her friends said, let's go to this activity, come with me to this party, she used to say no. Now she said yes, but she made a goal to meet 3 new people every time. She did this starting in a semester, and did it. She did it. She set goals to talk to people, learn about them. As she started it, she still hated it, but by the end of the semester, it was easier and easier for her to talk to new people, and then she enjoyed it and really felt like she had improved that personal attribute. We think of personal attributes as and personalities as just the way we're born. The committee was very impressed with her and another person who, in her application, what she did to help her introvertedness was she got a job at the, Jack in the Box window. So she had to talk to strangers all day long while she was at work. So we thought that was impressive, that the person realized something that could be better and then made that happen. So that slide right there is just to illustrate some things that you could do. If you're a mentor in a program or a mentee, then I think that's a good thing to put. It could be in leadership section or extracurricular. We'll find it wherever you put it. So let me see what's next here. Work, of course, shows there are numerous lessons. So you'll want to, this is a section where you can repeat things and put them in the work section. And now I think we're just open to all kinds of questions. So I see for people taking the MCAT around April, May, June, your committee wants a score before they write. That's not too uncommon. I don't think it's that detrimental to the timeline. So we realize that committee letters sometimes come along later. It does affect a few people, as I talked about before, and we have to go chasing down. First, we go to TMDSAS to make sure they don't have it either. And between TMDSAS and the school, that's what we do is we go, we tell the applicant, can you do anything, or, get us something else so that we do have some letters of recommendation on file. Yes, you can email me later. We will post and distribute to you a way that we'll do another Q&A chat. I want to make sure I got to all these questions, so I'm on for a few more minutes here. I'm scrolling back up to find my chat. So yeah, we need letters, but we try not to let that hold things up. Strong MCAT score is one that's around our average and above. When would I would suggest if you're around the national average and above, I would expect you to get some interviews. Okay, so I would say 509 to 511. You might consider not retaking it. Of course, when you retake it and it's stronger, you're going to have more action. Can interviews be passed out if secondaries have been submitted? So that'll depend on every particular school, and if it's an invited secretary, if it's an invited secondary or just a requirement for the application. So we don't have a secondary. That'll depend school to school. So we will interview people without a recommendation letter requirement met or the committee packet. Okay, and if you're a re-applicant, yeah, probably just reworked. You probably need to rework those essays. There's been a year, right? So there might be other experiences or other priorities that you see. Let people read it. If we do some of that later, we might be able to, honestly, since some of our travel has been canceled, we might be able to help with some personal statements also, but let people read it. And if it's just outstanding, maybe you don't need to. But one of the first things some of our committee members do is look at the old and the new essays to see if people went to the trouble to rework it. So Sohan says, is it detrimental to only have healthcare related community service? Instead of no, that's not bad. That's not bad. In other words, if you're volunteering at the hospital, that's excellent. So I might split those and put healthcare volunteering in the community service section, and then your more direct high value healthcare experience, the apprenticing and the scribing in the healthcare place. Okay. So let's see. You're very welcome. I'm glad it cleared some things up. Graduating a semester early. So I love time. I love time. So if you're graduating a semester early, I'm going to ask you, how much time can you devote to MCAT study? People would give a lot to be able to have 3 months to, just do MCAT 8 to 5. And those are the people who I see who are very successful. That being said, you could do study, you could pick, you could be a mentor in Big Brothers Big Sisters for a sustained high value community service thing, right? You could learn Spanish, take a cooking class, do some things for fun. Do a mission, do a medical mission or a community service mission, all kinds of things of value that we've talked about or you've seen on the slides today that would be valuable. So formal versus informal post-bac programs, if it's to boost the GPA and it's an informal way and you've just accumulated enough hours in science to move that needle, that is fine. That is just fine. Sometimes a master's program is good as well. Another degree is fine. If you're doing it to move the needle, you just have to make sure it moves the needle. When people are trying to repair a GPA that is a science GPA in particular, and you're doing a master's in public health, you're not going to rack up too many BCPM hours. So that's not really helping, right? So we'd rather see you, continue on and take more courses in just a post-bac way. I know that finances are an issue, so sometimes people might have a most cost-effective way to do that. Priya's question, did I get it? Yes. Okay. So that was the post-bac question. And sometimes people want to consider doing that when their GPA is really okay. I don't think you need to repair a 3.6 and above. Now, 3.5 and below, certainly just above the threes. Look into that 10-year fresh start where you can wipe out things if it's been a long time. Look at how many hours you need to figure out how many hours of A can birth. There probably is a grid out there that shows you how many hours of A you need to change your GPA. So both things would be valuable. I know that the UNT program gives you some other experiences like community service and MCAT prep. And upward trend is great. So sometimes that does it, Yes, so our school does accept letters of interest or explanation or update letters. Okay, I'm doing Joshua's question here. If anyone 2021, I think that's an awesome idea for y'all to get together. So you all get together, that's excellent. And if I can help you as a group, reach out. I don't think you need to, so the deans, I'm talking about Katie's question, if you're a reapplicant, do we need to get new letters of recommendation? So no, for at least one more year, you do not. So for the first reapplication, if you just ask that person to send the same letter redated, that's fine. That'll be in the handbook. We had a big discussion about it and said that we were going to accept the same letter 2 times in a row. After that, you probably want to get some things updated. Yes, that's how it happens too, is everybody getting together. Josh, that's how winning happens. You're very welcome. You do, and the GPA barely moves up. Yes, probably. We do look at the last. We do look at the trend for the GPA. So, and it's just a shame if the first semesters are really impacting that GPA, making it very low, too low to overcome. The people who are in a situation where they've been out for a while and can use that 10-year cutoff, that's a very good position to be in. And then, so otherwise, I think, yeah, unfortunately, you might be filtered out for very low stats, but the other way to do that is stay current with science and rock that MCAT. We do have people every year with very low GPAs who do great on the MCAT, and that helps us know that they're not an academic risk. When you've had a long break, and is it still okay to apply after a long break? Absolutely. You want to apply with some current experiences in that personal bio section. I think so. Letters, when you've been out for a couple of years, one professor letter, if you can, if they, if you can find somebody to remember you and do a good letter, and otherwise, work experience is fine. Also, supervisors, people in supervisory positions. Community college for 2 years and then transferring to a 4-year college is perfectly fine. You need to show academic strength and academic strength in science, and you can certainly do it with a community college route, and your GPA and your upper level hours and your MCAT. Okay. Yeah. So good luck to everybody. Um, I I think a 3.5 looks good. 3.6 is good. You're very welcome. So let's go ahead, a quarter system. Somebody's asking, Aaron's asking about a quarter system, and that sometimes the classes are a little more rushed, fast paced. Would this be considered? Yes, I think we'll see that. I think we'll see that, Aaron. You might write a note about it in one of the essays, but I don't know that I'd spend too much time on it. In general, I discourage talking about GPAs and low MCATs or GPAs in an essay unless you can do it in just the right way. So I would be happy to look at that for you if you wanted to write it up, but maybe it's not necessary. So in terms of second bachelor's degree, doing post-bac for second bachelor's, honestly, we'll see everything. We'll see all the transcripts, but we will be focusing on what you're doing most recently if that original degree was a long time ago. Okay, Eddie, I hope that answers your question. So sorry about the video. I think I've hit a lot of the questions that were handed in. I'll get with the team and you're very welcome. Thanks. Nice to see y'all. Well, I can see you, but you can't see me. You're very welcome. We'll post and advertise in a couple of different ways when we'll be online again.